My name is Manish H. I'm a cardiac electrophysiologist at MedStar Health. Atrial fibrillation really is a nuisance and a pain for many of my patients. It can cause a lot of really significant symptoms like shortness of breath, fatigue, palpitations that certainly make them feel miserable. But as a physician, one of my most important responsibilities is also to protect those patients from having a stroke. When the top chambers are not beating normally, the blood doesn't flow normally through the top part of the heart. In fact, the top two chambers are essentially quivering. They're not contracting normally. And so when that happens, the blood can pool, and when it can pool, it tends to form blood clots. Now there's a certain structure in the top part of the heart, a little pouch that we call the left atrial appendage. That pouch is where virtually all of the blood clots form in patients who go on to develop strokes who have atrial fibrillation. So one way that we can help navigate that is with the WATCHMAN device. This is an example of the WATCHMAN device. If you look at it very carefully here, you can see that it's essentially analogous to an umbrella. There's a little metal framework, and over the top of this is a fabric. If I have the pouch, and inside of this pouch is where the blood clots were formed, the WATCHMAN device will sit right at the opening of this pouch and prevent any blood clots that are forming from inside of this pouch to leave this pouch. And by doing that, we can prevent strokes from occurring. MedStar Health was the first site to bring WATCHMAN in the region. We have been a leader in what's called left atrial appendage closure. We have significant experience with the device. We teach many physicians locally how to place the device, and we also teach many physicians internationally on how to place the device correctly. Fortunately, this procedure is very safe and very simple. The risk is less than 0.5%, which is extremely low. It takes us about 45 minutes to do. There is a very quick and prompt recovery. You're in the hospital for probably about 12 hours. You stay overnight and go home the next day. And so that provides really substantial benefits for our patients because they get lifelong protection from stroke, but they don't have to take a blood thinner. And there's some ongoing research that we're participating in where we do ablation procedures to treat patients for atrial fibrillation to help them feel better, and then also pair that with a WATCHMAN device to ultimately get them off of a blood thinner. And those two things in combination, we believe, is likely to be the holy grail, where we'll be able to take care of our patients' symptoms, but also reduce their risk of stroke long term. So we're very excited about that future.